A general anaesthetic will put you into a controlled state of unconsciousness. This is to ensure that you are comfortable and pain-free throughout your operation.
When it is time for your surgery, a nurse will escort you from the ward to the anaesthetic room, which is next to the operating theatre. This is where you will receive your anaesthetic before going through for your operation. Here, an anaesthetic assistant will introduce themselves and check your details again.
See, dated today by the patient and by the surgeon. So, sir, when was the last time you had food and drink?
The assistant will help you to lie on your back on the theatre bed and will attach some monitors to measure your heart rate, blood pressure and oxygen levels in your blood. A small drip will be placed at the back of your hand through which the general anaesthetic drugs are given. This allows the drugs to flow directly into your bloodstream. Just before the anaesthetist starts to give you the anaesthetic drugs, you will be given an oxygen to breathe in a mask as you drift off to sleep.
Put those nice thoughts in your head and you'll just be floating off. And we'll do our best to help fix your eye, and we'll see you in about an hour's time.
When you have gone to sleep, the anaesthetist will pass a breathing tube into your throat. This tube is connected to a special anaesthetic machine to make sure you continue to breathe easily while anaesthetised. Once you're anaesthetised, you will be moved into the operating theatre on your bed for your operation to start. While you're asleep, you may be given fluids and other drugs such as painkillers, anti-sickness medicines or antibiotics through the drip in your hand. This is so that you wake up feeling as comfortable as possible. The anaesthetist will stay with you throughout your operation to monitor you all the time to make sure you remain asleep and stable until your surgery has finished. After your surgery, you will be taken to the recovery room where you'll have your heart rate, blood pressure and oxygen levels measured by a nurse. You may be wearing an oxygen mask if you've had your general anaesthetic. The recovery nurse will check that you are comfortable, not feeling too sick or drowsy before you go back to the ward.
Hello, you're ready to go back, okay? Are you comfortable? Yeah. No pain? Okay, I'm just going to give a hand over.
On the ward, you will have your eye checked and your final set of heart rate, blood pressure and oxygen levels checked. You will then be given something to eat and drink. You'll also be given instructions on how to care for your eye at home after surgery and a prescription of eye medicines and painkillers if you need them. You can then go home to recover fully from your surgery.